Namaskar, I'm your host, anchor Nandini Arvindan here. This is a special series for Diabetes Par Charcha, which is happening at the 𝐂𝐻 Convention Center, Mumbai. We have a renowned doctor here, Dr. 𝐿 𝐂𝐡𝐨, who is a diabetologist from Guwahati, Assam. Welcome, doctor.
Namaste.
Welcome to the show. And could you please introduce
yourself?
Myself,
Dr. 𝐿 𝐂𝐡𝐨. I hail from Guwahati, Assam, and I practice in Apollo Sugar Clinic, which is situated in Guwahati itself. And I've been practicing diabetology since 7 years now.
Doctor, I have a question to you. What
Yes.
are complications of diabetes and how dangerous it is?
Okay. So, many patients, they come to us for just treatment of blood sugar levels, but then it is very important and pertinent question that we should know about the complications of diabetes, because it is not the sugar levels that kills the patient, but the complications. So when we talk about complication of diabetes, we broadly divide it into two segments. One is microvascular complications and macrovascular complications. Microvascular complications sets in very early. Those are nephropathy, neuropathy, and retinopathy. To simplify the words, nephropathy is kidney problems. Retinopathy is bleeding spots or new vessel formation in a retina, which can lead to blindness. And we have neuropathy, that is, the patient has problem in they lose sensation of in nerves, specifically in peripheral parts like start from feet. When we talk about macrovascular complication, it includes heart problem, brain problem, that means strokes, heart. When you talk about heart, we talk about heart attacks and heart failure. And also there is something called peripheral arterial disease, that is lack of blood supply in lower extremities specifically. So this happens because of, there is one process called atherosclerosis, which gets accelerated when you become diabetic. So these are different subsets of complication of diabetes, micro and macrovascular complications. Apart from this, we also have a lot of other acute complication of diabetes, like foot infections. You might have heard that people need to get their lower limbs amputated because of diabetic infections. And then there are some conditions like AKI, acute kidney injury. Then we have DKA and hyperosmolar coma. So these are acute complications of diabetes. But then if you want to prevent the long-term complication of diabetes, that is nephropathy, neuropathy, retinopathy, and cardiovascular problems, stroke, and peripheral arterial disease, then we have to take care of our blood sugar control and also blood pressure and cholesterol levels. So these are some more important points. When you treat diabetes, we'll have to allow blood sugar levels, we'll have to take care of all those things.
What would be your final message for the audience?
Well, my message to all diabetic patient and general population also is that don't focus only on blood sugar control, because this is not a number game. Right. So we'll have to take care of the complications, and we'll have to think about next 20, 30 years if we want to get good health out of diabetes treatment. Number is only a short-term goal, but then preventing complication should be our goal, a physician's goal, and also from the patient perspective, that should be your sole motto to prevent the complications.
Thank you very much, doctor. That was really valuable. I feel like the audience would have been really benefited out of this. So thank you once again.
Yeah.
Thank you.
Namaste.
For more information about the diabetes and how to control it, please follow our Facebook page, Diabetes Par Charcha. We're also available in Instagram, YouTube, and Twitter. Thank you.
Namaste.